Hi, welcome. That took me by surprise. Welcome back, everybody. I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Thank you for joining me this Friday afternoon for one of our sessions, just looking at a question that's been sent in by a viewer and which I think might be relevant to you or to somebody else. So please do consider liking this video and help me share it out, because lots of women do have these issues around fibroids. Let me just put my ticker up here to remind you. So please consider liking the video and share. Also subscribe to the channel so that we can do a lot more around this work. That really encourages me. And thank you to my viewers that send in these questions. I get so many of them. It is difficult to cover them all and respond individually to all the questions. And that's why sometimes I do come on the channel and bring the questions so that we can look at it and discuss. So today we're talking about fibroids, and let me just share the question. Let's take off the ticker. And so this is the question that we're tackling today. And of course, from the thumbnail, you see that's why we've come for the discussion. This lady has had fibroids and we don't know how long for. And she's had the fibroids treated. There are many different fibroids treatment options, but she's gone through a myomectomy, which is when the fibroids themselves are removed and the womb is left in place. It's left intact. So the womb is left intact. And after the fibroids, 18 months after the fibroids, they're growing back. One is growing back and she's afraid of going under knives again. What is the way out? Okay, so this is the question we're tackling this afternoon. And if you're watching me live, thank you so much for joining. Leave a comment. Let me know where you're watching from. If this resonates with you or you've had similar experience or want to ask a question around this, let's see if we can tackle it. Now, I am not providing a consultation here. There's no way that we can consult specific situations or conditions here in the video. That's not possible. But I think we can sort of look generally at what this issue covers, and maybe just profess some suggestions that you would need to go and speak to your own specialist, your own gynecologist about, and look at those options. So please bear that in mind, that we're not doing a consultation here. There's so much information that we don't have available to us to help, but we're going to just try and look at the subject matter and see what it involves. Okay. So first, many of the viewers on my channel, if you watch regularly, I've got a fibroid playlist, so you're familiar with what fibroids are. We know that they are benign growths from the womb of the woman, so they're not cancerous growths. Rarely will cause the kind of devastating growth that can happen from cancer. And fibroids are very, very common. The thing about fibroids being common is that many women have fibroids and don't even realize that they have fibroids because they don't have symptoms. So that's something else to think about, that fibroids is a big issue, but in the many women that it affects, it doesn't cause any symptoms. However, in those who have symptoms, it can cause very troublesome symptoms, and they can range from woman to woman. So you can have a group of 10 women with fibroids and they could have different symptoms, and the symptoms, apart from being different, they can also range in how intense they are. So this is such a subject, that it's such a condition that can cause different degrees of distress, and every woman has her story. So there's no real one size fits all. It's always important, and that's why I emphasize that this is something that we might talk about this here, we might share thoughts and ideas, but really to get the treatment that's best for you, dependent on your age, your symptoms, your medical background, any other medication that you're taking, and so on. It's best to sit in front of a specialist to have this discussion about yourself. We've not even talked about your own type of fibroids. How many are they? Where are they located? These are the things that are important. Okay, so that's what fibroids are. What are the symptoms of fibroids for women who get them? Let's just run through them. Again, I've got several videos of fibroids on this playlist, on this channel, with the playlist. I think I'll place the description. Sorry, I'll place the link to my fibroids playlist in the description once we're done with the stream, so you can just go and watch. But some of the symptoms are having pelvic pain, so pain above your pubic area, and that pain can be at any time. Okay, so just that discomfort that's always there or that comes and goes. Another problem women could have is painful, irregular, and longer periods. So generally, periods that are just all over the place, they are heavier, so heavier than you would expect. People are flooding, they're having blood clots, and then instead of lasting an average of maybe 4 or 5 days, they may go on and bleed for longer than 7 days. And then they might have different episodes of bleeding because of the fibroids. Because by simply being present in the womb, the fibroid can change the architecture, the anatomy of the womb, and in that way contribute to the different pain problems, bleeding problems that we often see. Now, while I'm on this subject, let me pull up. And if you're joining the live, hi, thank you so much for watching. I really appreciate your joining. And if you're watching on replay, thank you so much. And I hope this provides you with some value. I always like to share some images with my viewers. So let me remove this and put up an image of fibroids just so that we're familiar with what they are. So here we go. This is an image of the types of fibroids that there are. Okay, so we're still talking about symptoms, and I've talked about pelvic pain, I've talked about heavy periods, prolonged, that is longer periods, irregular periods, can cause painful sex, depending on where the fibroid is located. So apart from just that it's sitting there and making the womb bulky and uncomfortable, imagine if it's very close to the cervical canal, or sort of the entrance of the womb there. During sex, as the penis is hitting, or if the penis is touching the woman's the upper part of her vagina, close to the cervix, it may be touching or hitting a fibroid. So that will cause pain. That can lead to painful sex, or just simply the fact that your womb is bulky because there's a fibroid there, that can cause some discomfort. It can also cause, as you can imagine, the womb is bigger, the womb is stretched out because the fibroid is there. That can lead to bloating. You can't really eat properly because the heavy womb or the larger womb is pressing against your intestine. Back pain because the heavy womb is pressing against nerves where it ordinarily shouldn't be touching. And leg pain, similar reason. The nerves that go down to the leg are being pressed on because of the bulk of the fibroid. So different things that could happen. In addition to that, it might press on the bowel or the small or big bowel so much that it's difficult for your material from food material to pass, and that can cause constipation. So the food material can't pass properly, and the bowel can't contract and move properly, so a woman ends up with constipation. She could also have trouble with passing urine. It may be that the fibroid is made the womb so big, and the womb is pressing against the urinary tubes or ureters and preventing urination. So there are different issues that the fibroid could cause, and one other, which many women are of course concerned about, is its association with fertility. And remember, I always like to put this in context, and I recognize it as a valid problem. Not every woman with fibroids has infertility. It can depend on the number of the fibroids and where they are located, for example, and their size, that they could cause problems. If you're looking at this chart, for example, the one right in the middle, that's right within the inside of the womb, the submucosal fibroid, that is an example of one that may create problems, or if it's particularly if it's sort of lower down where the womb will where the fertilized egg will plant in the womb, it might make it difficult for the egg to plant, causing miscarriage, or when the baby is growing, it might make it a little bit difficult for the baby to grow. And I'm not saying that doesn't mean that women who have fibroids do not go ahead to have babies. Yes, of course they can. Many women do. It may create a problem, and it's not the same for every woman. Each lady should be individually assessed. Okay, so that's what I would say about the symptoms of fibroids. And we're also talking about the treatment options. This lady in particular has had a myomectomy. Before you have a myomectomy, remember that your doctor or your surgeon will discuss with you. Let's take this image. I'll bring it back on if we need to look at it in a bit. So before you have a myomectomy, remember that your gynecologist will discuss with you the pros and cons of each method, and you'll be offered the method that best suits your person. And so the treatment of the fibroid will depend on the symptoms that you're having. Like I've just mentioned, the range of different symptoms, but it can also depend on the number of fibroids, where they are located. So there are different types of fibroids, as you saw in that chart I just took away. Some women have just one fibroid, other women have more than one fibroid, multiple fibroids, and they can do different things. So it depends on where your fibroid is located, that the choice of treatment you would have. So in this case where a myomectomy has been chosen, the lady said she's scared of going under the knife again. So there are different types of myomectomy. There could be an open myomectomy. A myomectomy is when the fibroids are removed from the womb and the womb is left intact. And there are different reasons why that could happen. It may be that she still wants to have a baby, or she still wants to get pregnant. It may be that the surgeons thought this fibroid and its location will be fairly straightforward to remove via myomectomy. And then the different types of myomectomy, you could have an open one, so there is a cut made into the abdomen and then into the to expose the womb, and you can see the fibroid and it's removed. There could also be a laparoscopic or hysteroscopic myomectomies where you don't have those cuts, or you don't have large cuts made into the womb in the case of laparoscopic myomectomy, or hysteroscopic where the access to the womb is through the vaginal canal. So there are different types of myomectomies. Whichever one that she's had, one of the things that she would have been told is the possibility of growing back. And this is true really with whichever treatment for fibroids that doesn't involve removing the womb. So there is that kind of expectation that probably she was aware of this, and it is difficult to deal with. I really empathize with this lady who is presenting this question to us today. I really empathize with her because it's difficult going through, preparing your minds to go through surgery, having the surgery, hoping it will deal with the situation that you want to have the surgery for, and then coming to deal with it again less than 2 or 3 years later. That's really very painful. So in terms of options, does she have options? This will depend. This will depend on her symptoms and what she's interested in, her wishes, her age. You know, it will depend on a few different things. And that's why, again, I emphasize it's good to have this discussion with your practitioner, with your gynecologist. Okay, because if this is somebody who is above a childbearing age, then it may be. And again, we're talking generally, we're not sort of providing specific answers. We don't do that. My responsibility is just to provide information and give education so that we can use that to go back and speak with your practitioner and say, will this work for me? Can we consider this? And have an informed discussion, because that will help you get the best option for yourself. With knowing the knowledge of these different methods will help you get the best option. So if we have somebody who is past childbearing age and is having to deal with symptoms from the fibroid again, because remember, the fibroid might come back, and if it's not causing any trouble, one treatment is just to leave it alone. We've said that when many women have fibroids, they don't even realize that they have fibroids, and it's not causing any symptoms. But of course, in this case, we're talking about it. She's brought the question. She must be having some kind of symptom, but I don't know what. She's not said what symptoms she's having. So if it's to the point where it's so uncomfortable and disrupting her ability to live life, as you know, she is entitled to, just as every one of us is entitled to live pain-free without discomfort. And if it's something that can be done, then she may want to consider a hysterectomy. And I know she said she's scared of going back under the knife. And I appreciate that. And it's easy to say these things, and you have to put yourself into the particular frame of mind. It's then important to think about the pros and the cons. She will have to sit down and think about the pros and the cons, and whether the pros are worth overcoming her fear of going back under the knife to have a hysterectomy. For example, hysterectomy, I'm sorry I didn't explain, but hysterectomy is when the womb itself is removed, and it is a form of treatment for fibroids. And some women who have very distressing symptoms with their fibroids can experience significant relief, really life-changing relief, if they choose to go down the route of hysterectomy. So if you're just joining, thank you so much for coming on board. I am talking about what options a woman who had fibroids and had a myomectomy some time ago is now faced with a recurrence. They've come back, and this is real. This is very real, valid experience, and it's really painful. And I'm talking about this, looking at options, saying that we don't have, I can't give you all the answers here on this video because I don't know your specific medical background. And I encourage this discussion with your provider, your doctor, your specialist, to look at your medical background, your specific situation, if you've got kids or not, how old you are, if you've got any other medical problems, to identify what is the best option for you. And we've looked at things like do nothing. If it's not causing any problem and it's come back and it's a small one, do nothing, okay? If it is causing problems, which is most likely the case here, one option to consider is hysterectomy. That's what we were just talking about, the possibility of a hysterectomy. And that might favor somebody who is 50s or late 50s and just thinking, you know what, I don't want to go through this stress again. And let me quickly add, generally we do believe that fibroids should shrink as you enter menopause. Some women, that's not their experience. So I don't know what's going to happen in an individual person's case. And so there's still a lot of studies and a lot of work that we need to do to understand how fibroids work. We still don't know exactly why they happen. Okay, we know there may be genetic link. We know there may be something to do with estrogen and hormones. We're not 100% sure. So we're still doing a lot of work in that area. Now, apart from hysterectomy, is there anything else? Do you know, if we had to choose between a hysterectomy and myomectomy, and again, it's dependent on her specific feelings, would she want to go and have another myomectomy? It depends on what she's looking for. It depends on what she needs. She's still trying to go through pregnancy, because don't forget that with each surgery, the possibility of having a scar on the womb is there. So these are things to think about, to consider as one is intending to go into this process. Again, the people that are in the best shape to answer this question with you and for you are your surgeons and your specialists. So in terms of another myomectomy, I'm not really encouraged. It may be an option. It may be an option depending on her life situation. It may be an option. I'm not throwing it away altogether. But it is something that the chances that it might grow back again after another few years. Okay, another treatment option is uterine fibroid embolization. This is a procedure that's an alternative to surgery, and I talk a lot about it on the channel as well. It is on the playlist, and you can have a look at the videos I've done on explaining the procedure in detail and its effects. But basically what it is that the specialist is trying to block the blood flow to the fibroids by injecting some chemicals, some compounds through a blood vessel in the leg, commonly in the leg. And by the time the blood supply to the fibroid is blocked, that shrinks the fibroid, it eventually dies. So that process doesn't need surgery comparatively. So the only kind of access would be the access through the blood vessel, where the doctor will have to insert a cannula or insert the material, the tube, the tiny tube that they need to be able to gain access through to your the blood supply to your womb. So there isn't surgery per se in that sense. So that's uterine fibroid embolization. So for people who don't really want surgery, and it does have its other advantages, please do go and look at the video on my channel. But the thing here is, well, after that, will fibroids grow back? Fibroids could also grow back in uterine fibroid embolization. So that's something else to think about. If you're trying to have a baby, it's not the first method recommended if you're trying to have a baby. There are some reports of women who have gone on to be pregnant after having UFE, that's uterine fibroid embolization, but it's not the first option that's recommended, because sometimes some women have had difficulty getting pregnant after this procedure. So there is that to think about. What else? There is also ablation treatment. I'm just going through different options of treatment. She's saying, what is the way out? My answer to that is, darling, you need to sit with your specialist. Yeah, you need to sit with your specialist so that they can look at your medical background and look at the situation around you, look at the symptoms, look at what you need. That's a really important discussion to have. But yeah, there's ablation treatment as well. Which is where they use some treatment, apply some kind of heat treatment to the lining of the womb. And what that does is it destroys the blood supply to the fibroids, and the fibroids will shrink and die. Again, that's another treatment that's not recommended for women who want to have children. So it's not something that you would encourage somebody who hasn't yet had children and still wants to have a family to do. Might be for somebody who is in their after menopause, for example, maybe late 40s or 50s, and still having very heavy bleeding, but does not really want to go under the knife for a hysterectomy. So that may be a method that they will be that may be more comfortable with. So that's an option that could be considered. So these are some of the treatment options, but let's not forget that there are all other medical treatments. And again, I'm thinking quite widely around this subject because I don't know much. This is the only information that we've been provided that I have in front of the screen with me. And she doesn't tell us anything about her background. to sort of help us go more in one direction compared to another. So let's bear that in mind. But there are other treatments whereby people would use fibroids would treat fibroids, and it could be something to do with a medical option. So that could be simple pain relief, if the symptom problem is more or less pain relief. So these are the non-hormonal measures, simple pain relief. It could be those that contain opiates like codeine, or those that don't contain opiates, maybe non-steroidal anti-inflammatory medicines, maybe enough to manage the pain. Some women who don't want to have a family yet and are trying to deal with the fibroids, they might have hormones like the Mirena coil, so the hormone progesterone coil, that can sometimes help. It might help to stop the womb lining growing very quickly and help to manage the fibroid. The other hormone medication tablets that you could take that could help to shrink the fibroids and affect the symptoms as well. So there are those considerations, and I think that outside of having any specific information with the sense of what is the end game here, are we just dealing with symptoms? Are we still in a situation where we want to have a baby? What are the options? That's what will determine which choice to go for. So I thought I would bring this forward for discussion and just sort of share my thoughts around which way your doctor might want to approach these things. I think it's important to do as much research as possible. When carried out in a very good center with experienced practitioners, doctors, nurses, and healthcare support staff, the risk of things like infection, bleeding can be minimized. So what you need to be looking at is what are your needs? Are we controlling symptoms only? Or is it a type of fibroid that perhaps has affected your fertility? And remember, I said at the beginning that fibroids do not have a blanket effect on a woman's fertility. It depends on where they are located and other things. So many women have fibroids and go on to have pregnancies. Yes, there is a small number where the fibroids can affect them. It might lead to miscarriage. It might lead to a C-section because they can't have a vaginal birth and so on. So these are some of the considerations to have. Now, natural options. I do talk about natural options because I know many of my ladies like the natural options. And yes, of course, when you're thinking about the possible side effects of hormones or the possible complications of surgery, yes, why not an option where you're less likely to have those complications? Now, it's not true that natural options completely come without side effects. Please always be careful to do your research, speak to your specialist, because even natural options can have some complications. They could cause problems, for example, kidney damage, depending on the type of the nature of the supplement. They could affect the liver. They may not agree with other medication that you're taking. You may not be sure of how much to take. So these are some of the challenges. I am familiar with some natural options that may help to control some symptoms like pain, for example. But natural options that actually remove the fibroids, we don't have any evidence to support that. So I would be very careful and you sort of look at what is it that you're trying to do, because again, remember, we're not saying that every woman with a fibroid must have it treated. It's if it's causing problems. Okay, so it's something to have really lots of thoughts about. And I do believe that there is a way out. I think that sitting down and looking at things with your specialist will guide you depending on the impact it's having on you. So this is what I'd like to say about this subject. And I do hope somebody finds it useful. I hope if you come across this thumbnail, you come across this video, please click on it and just listen and consider that there are options. I really want women not to give up, not to feel that it's over. If you're bothered by really serious symptoms like the ones that we mentioned at the beginning, or the challenge of having children, this is something to discuss with your specialist and get support in terms of the different options available. So guys, thank you so much for watching. Thank you for joining me this Friday afternoon, just before the weekend starts. I hope you've got great plans for the weekend. I am looking forward to a restful weekend, but I had these questions. I just wanted to make sure that I cover them for those that asked. And if you're watching on the replay, thank you so much for clicking. Don't forget to like the video, subscribe to the channel, and importantly, to share this video. Somebody might find it useful. So thank you again for joining me. I will hopefully be seeing you again at another live stream next Friday. But before that, there are lots and lots of different videos I've got uploaded, scheduled to be published in the next few days on the channel. So yeah, please turn on the notification bell so that when those videos come out, you are the first to know about them. So thank you so much for watching, guys. Take care. Bye-bye.